good morning again, Club 65 Golden Years Insider family. Welcome to another edition of Medicare Mondays with Renee. Today's episode is going to be about getting the care you need. And today we're going to be walking you through how we are going to be getting the care and the help that we need through our Medicare or Medigap plans. I want to talk to you about that. Make sure that everybody listening is clear, is able to get good information, and able to go ahead and do the research that you need to do to make this, to get the greatest benefit from this episode. Okay? All right. Getting the care you need without breaking your budget. Hosted by Renee Dawson. Helping seniors make informed decisions. Hosted by Golden Years Insider on YouTube at Club 65 Plus Insider. Okay? Now, we have a question for you today. Can you afford not to use your Medicare benefits? Rising healthcare costs, delaying treatment, preventive care saves money, and knowing your plan. Can you really afford not to use your benefits? The goal isn't just having Medicare, it's knowing how to use it wisely. The real barrier and why access matters is because things like transportation to and from your appointments or to pick up your prescriptions, provider availability, getting an appointment with your healthcare provider in a timely manner, and dealing with long wait times for treatment. Why this excess matters? Because prescription costs, the cost of your medication, understanding the rules of your plan, knowing how to access your plan benefits, working with your carrier, your customer or member services phone number, knowing what that number is on the back of your card, what it means, okay? Also, understanding your evidence of coverage. That is the actual legal document that covers your, governs the relationship between you as the beneficiary and your insurance company as the contracted vendor for Medicare, okay? And they're required to provide you with that evidence of coverage, that contract, upon request. Okay. Now, as your insurance agent, we typically provide you with the summary of benefits, either in a paper or written form or a digital format provided by the insurance company. Okay. As we're licensed and appointed by the different carriers, we have access to their benefit information. Okay, so it's important that you understand the rules of how to use your plan, and then prior authorizations. Okay, having insurance doesn't always mean getting timely care. Sometimes the insurance company, before they approve a referral, they want you to get authorization for that diagnosis, for that treatment code. It's a billing code or treatment code that they recognize under contract with your medical service provider. Okay, building building blocks, the parts of Medicare. Now, it's important that you understand the different parts of Medicare, not just know them. Your Part A covers your hospitalization. Okay, if you've been employed and you paid your FICA taxes for what Social Security requires, a minimum requirement of 40 weeks of paying into the system, then you're eligible for your Part A hospitalization benefits when you turn 65. Okay. Part B medical covers your doctors, covers your specialists, covers your medical equipment. It covers your preventive care, your lab work. Those are the things that are covered under Part B. Okay. Then Part D covers your medical prescriptions, those that are included in your carrier's formulary. They make up your Part D prescription drugs. Now, it's important that you recognize and understand the difference between Part D medications and Part B medications. Part B typically deal with the extended care for like cancer treatments, infusions for chronic illnesses or rare illnesses. Okay, they come under Part B prescription drugs, and they are not covered at the same rate as your Part D. All of your Part B medications are typically covered at 20%. So those would be like your vitamin B shots or your special allergy shots. Those are typically under your Part B medications. Okay, Medigap. Now, Medigap is that supplement that for those beneficiaries that prefer to have the original Medicare. Okay, the 80-20 deal where they cover their Part A hospitalization, their Part B medical, and they are required to have that Part D prescription drugs. Okay, everybody's required to have prescription drug coverage in Medicare. But for those that choose to remain with original Medicare, they don't have to worry about a provider network. They can see any doctor anywhere in the country that accepts Medicare, that's been approved by Medicare. So they don't have those limitations of provider networks. Okay, but they do have that 20% copay, and so for many of them, they have elected to, you can elect to enroll in a supplement plan, which covers that 20%, and some of them do a little bit more. They cover the so many pints of blood and other benefits. Now they are listed, and the types of plans and the benefits of those plans are listed in your Medicare and You handbook. Okay, and so a good time to examine that is to note that there is no special enrollment period for you to enroll in a supplement. Okay, and so the premiums, even though the plans are standardized across the country, a Plan A in Florida is the same as a Plan A in California, Plan G in Florida is the same as a Plan G in North Carolina, but the cost, the premiums, is what varies from county to county, state to state. And so that you want to make sure that you get good information from your licensed insurance agent on how that, if you want to enroll in a Medigap program, how that will impact you. All right, let's take a closer look at Medicare Part C. What you need to know. Okay, Part Medicare Advantage combines Part A and B benefits. Okay, that's hospitalization and medical. It's offered by private insurance companies like your Humanas, your Aetnas, your United Healthcares, your WellCare. Okay, your Devoted. Those are private insurance companies under contract with Medicare, CMS, to provide you, the senior, with healthcare coverage. These plans may include a provider network and referral net requirements. Okay, they often include prescription drug coverage, and so your Medicare Advantage plan, which is known as Medicare Part C, covers the whole ball of wax: hospital, medical, prescription drug, and then says it may include provider network and referral requirements. Okay, preventive care can actually save you money. Okay, having those annual wellness visits can catch symptoms early. Okay, mammograms for all the ladies. getting those mammograms in a timely manner, and monitoring your own health, doing your own self-exam. Get a buddy to that you can be accountable to remind you to help take care of your health. Okay, colon cancer screenings. For those of you that have a history, a genetic history of colon cancer, it's imperative that you maintain your vigilance and get your screenings done as often as your doctor says. Okay, diabetes screening. Here we go, back to the family tree. If it's in your family, make sure you get those screenings. Okay, even though you may not be showing the symptoms and may not have any medications or be treated for it, if it's in your genetic makeup, you want to monitor it and make sure that you stay ahead of that. Watch your nutrition, okay? Because diabetes is caused a large in part to our nutritional and eating habits. Okay, vaccinations, preventive care. Okay, getting your vaccinations, the flu, the shingles, RSV, pneumonia. These are vaccinations that the medical community is saying helps to save the lives of seniors. And I know personally, having had 2 bouts with pneumonia, that it's important, number one, if you're able to handle that vaccine, to go ahead and get it done. Okay, and get that vaccine taken care of so that you can, number one, have what you need to fight the disease. Okay, all right, so just do this right quick. All right, next we want to talk about bone density testing. Now, for us as seniors, it's important that we take care of this, that we monitor it, because as we grow older, our gait and our walking ability changes, and because of the compression of the spine. I'm just kind of repeating some of the things that my doctors told me, and that we become more prone to fall. Sometimes it's a hearing imbalance. Okay, that's why that annual hearing exam is important. I asked my clients several times, well, have you done your 3 exams, your 3 free, vision, dental, hearing? You get 3 annual exams for screenings to check those areas of your what we call ancillary, to make sure that you're not being susceptible to any symptoms of disease. Okay, and so it's important that you do get that density screening. Okay, so that you can prevent falls. And then there are exercises that we can do to strengthen our musculoskeletal system. Okay, it's been published in several medical journals that after we turn 50, we lose 8% muscle every year. Well, that affects your ability, your gait, your standing, your walking. It affects all of that. And so I want to encourage you to make sure you get your bone density testing, particularly women. Okay, know your team, getting the most from your plan. Okay, now this is where I sit down with my clients and I let them know. I say, listen, you are the head coach of your healthcare team. You run the show, but you have got to be accountable to you. You have to keep a record of your health care, how the medications are making you feel, your appetite, if you're working to lose weight, what exercises you're doing, and what your accomplishments are. So when you sit down with your doctor for that 15 or 20 minutes, you have your journal, your little notebook that you can sit down and talk to them about how the medication is impacting you, how your appetite is being affected by the medication. These are things that they need to know, because nobody knows your body like you. Okay, keep a journal. Make sure you have your journal that details the symptoms, and ask questions. Why is this happening when I take this? Da 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 da. Why is this happening when I lay down? I take the medication, when I lay down, I feel dizzy. My head feels heavy, or whatever feels out of order. Make a note of it. And the opposite is also true. If you're taking the medication and you're getting more energy, the medication is doing what it was prescribed to do. You want to make a note of that as well, so you can communicate that to your doctor. Now, what about specialists and options? Okay. PPO and Medigap plans do not require referrals. That's one of the key points about the PPO plans. They tend to be a little bit more expensive because they give you more freedom and the insurance company less control. Okay. And Medigap does not cover referrals because you are on original Medicare. Okay. And original Medicare, you can see any doctor that accepts Medicare. And so Medigap plans do not require referrals. Okay. Then there's telehealth and urgent care. Okay, having access, your plan, and more plans now are providing access to telehealth because of the time that it takes to get an appointment with your primary care or with a specialist. And so they're providing this as an alternative to, and then they may recommend you to go to the urgent care. And the urgent care, because they have the equipment and facility there to see you personally and to examine you, they can make that determination whether or not you need to go to the emergency room or they treat you there in their facility. Either way, it's covered by your plan. Hospitalization, urgent care, emergency room, telehealth is included in most plans nowadays. Okay. And then the nurse advice lines and home health. Okay. You'll note on the back of your card whether or not your plan includes 24-hour nurse assistance. Okay. And they're available in the event that you can't get to a doctor and you can't drive to the emergency room. They give you immediate action steps that you can take based on the symptoms and of what's happening to you in the moment. Okay. And then there are the home health services that are available in most plans today, where you can have someone come in and provide housekeeping assistance, or the seven functions of daily living. You need assistance. You've had surgery and you're home alone. You need assistance bathing, eating, cooking, okay, preparing your meals, and they can provide that service in their home health plan. And you have to make sure that the vendor that provides the services is in network with your carrier. Okay. All right. Lowering your prescription drug costs. Let's talk about how you can save money on your medications. Number one, request generic medications. Okay. They are the lowest cost, and most generics in plans today are at zero cost for your copay. Then work with your plan's preferred pharmacies. Every plan does not have the same preferred pharmacy. Okay. So you want to check and make sure you talk to member services. What is the preferred plan for the preferred pharmacy for my plan? And they will tell you, okay, well, our preferred pharmacy is Walgreens, but you can go to Publix, Walmart, CVS, but we're under contract. Our contract is with Walgreens. And so what you will find is that same prescription drug, that type tier 3 medication that will be $47 under your standard retail plan by going to Publix, you pay $37. But if you went to Walgreens, that same medication will probably be $37 because they have the preferred contract status with your carrier. Okay. Mail order options. Now, a couple of carriers have their own pharmacy, mail order pharmacy network. I know Humana does, and theirs is called Centerwell. So if you are a member of a Humana plan or a Care Plus plan, you have the opportunity to have them present you with a marketing interview to talk to you about how their mail order plan or service can save you money on your medications. Okay. What about manufacturer assistance? You may be a senior taking some rather expensive medications for a unique diagnosis, and so your doctor may introduce you to a manufacturer assistance plan because you can't afford the cost of those medications. I remember when I was being treated for cancer, and my maintenance chemo after I'd gone into remission was over $600 a pill, and I had to take 15 of them, initially 15 a day for 2 weeks. And then the cost of that was exorbitant. So my oncology hematologist referred me to a program that the manufacturer had that I was eligible for because at that time I wasn't working. And so it made the medications affordable. It brought the cost down to what my husband and I could afford. And they even provided my doctor with some of the medications to give to me up front. Okay. And so manufacturer assistance, ask your doctor, hey, is there a manufacturer assistance plan that can help cover the cost of my medications? That's another way for you to save money on your prescription drugs. Okay. Extra help and low income subsidy. Do you qualify for extra help? If you're a single individual and your annual income from your all sources is $23,475, which averages about 1,956 a month, you are eligible. Okay. If you're a married couple, okay, and your total income is $31,725 a year, okay, or on average about $2,644 a month, okay, you are eligible according to Social Security Administration and Medicare.gov 26 figures based on 150% of federal poverty level. Okay. And so now, working with your agent, you say, well, hey, I don't get that kind of income. Then you need to reach out to your agent or to Club 65 Plus and schedule an appointment. And we will walk you through the application process. It's very simple. Okay. As long as you don't have stocks and bonds and trust fund and $20,000 in savings. They do allow you to have some savings. They do allow you to have insurance. They do allow you to own one home, one car. But if you have rental property that's generating income for you, then no, you really don't need extra help to cover your medications. You're getting that money in your rental income, and so the plan is for those that are in need, and that's why they limit it to one home, one car, no rental income. Stocks and other assets, they have a ceiling, I think 14,000 for singles and about 24,000 for married couples. And that figure may not be current. It sounds like it may be from last year, and we'll update you in our next episode. But we wanted to share with you that you just may be eligible for extra help from Social Security. Okay. All right. Here we are. Home health support services. Now, many plans now include home health services, skilled nursing services for you if your doctor requires you to have skilled nursing care after you've had a hospital visit for maybe a stroke or you had a hip replacement surgery. You may, and you can't manage at home and you need to get stronger before they release you to live at home alone, then they'll send you to rehab at a nursing facility, okay? Then there's physical and occupational therapy that's included in most of your plans that will help you to benefit from your coverage fund and get the care that you need, okay? Let's talk about durable medical equipment. For those of you that may be in need of wheelchairs and walkers and even the motor scooters, the chairs, the electric chairs. That's durable equipment, and it must be prescribed by your doctor. Okay, the doctor has to prescribe it, and the insurance carrier has to provide the authorization. Okay, and then they'll direct you, once you receive the authorization from them, they will direct you to their vendors that are in contract with them. Okay, and so that's an 80-20 deal. Okay, the insurance company will pay 80%, and your copay for that equipment will be 20%. Okay. Now, many people don't realize Medicare may cover these services when certain medical criteria is met. Okay. Now, here's some common mistakes that you need to avoid. Don't wait till you get seriously ill, too sick to go to the front door and unlock the door for your emergency response team. Okay, or nobody close to you has a key where you can access to get to you in the event of an emergency. So if you're feeling ill, number one, let family know. Number two, let a neighbor know. Okay, and number three, call 911. Okay, call 911 and let them know what's happening. Number two, skipping preventive visits to your doctors. Okay, missing that specialist appointment. Okay, these are common health care mistakes that we make as seniors. Ignoring your plan notices. Your plan notifies you, hey, it's time for your for this visit. It's time for this lab, this preventive test, and we'll reward you by going and getting your screenings done. And you ignore them. Okay, don't do that, because it's there to help you stay healthy. Another common mistake is using out of network providers unintentionally, but they're out of network. So they'll either notify you when you get to the office that they're no longer in that network. They do not take your insurance. Okay, if you are in a PPO plan, okay, then PPO, if they don't carry, if they don't accept your coverage and they're not in network with your plan, most PPO plans will allow you to see an out of network provider, but it may cost you an additional copay. Your copay in network is $35, but if you see a doctor outside of your PPO network, it may be more. It can be 50%. It can be $10 more. And in some PPO plans, it may be no difference. It's the same as your in-network provider copays. Okay, so those are some things that you need to look for, or make sure you make a note of when you sit down and talk with your insurance representative. Okay, not reviewing benefits annually with a change in diagnosis. Okay, so this is very important. Okay, you're seeing your doctor, and your doctor is saying, hey, we did some lab work, did some tests, and we see that we need to do further tests because we see what looks like a diagnosis of XYZ. And then you say, well, oh, wow, what do, and he says, well, this is the plan of treatment for what this diagnosis requires. We have to we have to begin treatment with this, and make sure they explain the steps to you. You make sure you understand what the plan of treatment is for that new diagnosis, so that you can, number one, understand it. Number two, explain it to your family or those that you have entrusted to be your healthcare surrogate. Okay, you want to make sure you have that documentation in place. Okay, and then you are able to explain to them the change in your diagnosis. Okay, and you want to make sure you make a note of it so that you call your insurance agent ASAP and say, listen, there's been a change in my health. These are the things I'm dealing with now. I need to activate my indemnity plan, or I need to get an indemnity plan. You need to make sure you talk to your agent about any changes in your diagnosis, because it may trigger a plan change. Whereas before, you were on a regular HMO plan, and now they've diagnosed you with cardiovascular disease. Okay, well, that under Medicare guidelines is a chronic illness for which there are chronic special need plans that are designed to take specific care of that type of diagnosis. Okay, and so you need to make sure that your agent is aware of your diagnoses so that if necessary, we use that chronic special illness diagnosis as a special eligibility plan to get you enrolled in a chronic special needs plan so that your doctor has the resources via this new plan, this different plan, to provide a greater level of service. Okay, and so that's why we don't want you to make the mistake of not sharing that information with your insurance representative. Okay, now time for you to be your own advocate. Ask questions before care. You get referred to a different doctor. Ask the question: is this doctor in my network, or is this doctor just a friend of my primary care doctor that they want to support and send me to? What will my cost be of this test or this seeing this doctor? Okay, my copay for seeing specialists is $35. Are they going to charge me more? How much will that be? Okay, now Medicare has a law that they can't charge you above what the plan says. Okay, they can't do the after billing thing. Then is there generic medication available? These are questions that you ask before you complete that care visit at your doctor's office. These are typically covered by your agent during a needs analysis and an in-depth review of your health prescriptions and plan preferences, whether it's HMO, PPO, or Medigap. Okay. Now, your resource. I'd like to present to you Club 65 Plus and how we can help. We pride ourselves on Medicare education, educating our clients and the public on the changes and the benefits of the Medicare healthcare system. Okay? It's important that you understand that Medicare is a healthcare system that is interlocked with private insurance carriers and vendors to provide you with the medical resources and coverage available. Okay, now we also do benefit checkups. You can log into, or you can go to Club 65 Plus and sign in for a just give your name, phone number, and email address. No other details than that, and we can schedule you for a benefits checkup. Okay. We also provide one-on-one guidance where we review your plan, talk to you about your needs assessment. Okay, and any changes in your diagnosis or prescriptions, and walk you through the plan, the benefits of your plan, and how to best use it. Okay, and then we do community referrals. We do community events, and we look forward to working with our senior communities and housing in areas of housing, and our food banks. Okay, I worked several food banks in the past couple years and assisting, just giving information and clarity to individuals, not just seniors, but individuals on health care, their Social Security benefits, and how to access those benefits online at Medicare.gov and SSA.gov. Now, one note to make is that Medicare.gov is open 24/7. Okay, and you can call them anytime and ask them questions on their healthcare system. Okay. This week, here's some action steps for you. We want you to go ahead and schedule your wellness visit at Club 65 Plus. Okay. Review your provider directory and prescription list. You need to know the specialists that are in your network. Your member services department of your insurance carrier will email you specific information and contact information for specific carriers or specialists. Okay, and also their prescription formulary. They can email you your prescription list. Okay, also, you need to verify your preferred pharmacy. Check your plan. Check with your member services code and say, well, what's the preferred pharmacy for my plan? Okay. You may find out that it's the pharmacy that you're currently with. If so, fine. If not, they may say, well, okay, our preferred pharmacy is a Walgreens. Okay. And so you may been getting your plans, your medications at CVS or Walmart. Well, what you'll find out is if you get your medications from Walgreens, the prices are going to be lower because they're under contract. Okay, with for their beneficiaries with that particular plan number to be in network with Walgreens as a preferred pharmacy. Okay. All right. Then the next step that you take is write down 3 questions for your next appointment, whether it's your primary care doctor or your specialist. Okay. Sit down in the quiet, think about your medications that you're on, how they make you feel, and then begin to journal. And then write 3 questions, at least 3 questions for your next visit. Okay. Coming up in our next episode, we're going to talk to you about housing and aging in place. I'm very excited about this episode that we're doing. We're working on planning and that now. We want to talk to you about living safely, comfortably, and independently as you age. Home safety and fall prevention. We're going to talk about home modifications and community resources. We're going to also talk to you as we broadcast and let you know we broadcast the second and fourth Monday of each and every month right here on Golden Years Insider at Club 65 Plus. And I look forward to seeing you in our next episode. It's important that you remember that good health isn't just about treating illness. It's about staying healthy enough to enjoy life. So if anything that I've shared with you today has benefited you and you find it helpful, would you please subscribe to Golden Years Insider on our YouTube channel at Club 65 Plus Insider, okay? Our call to action reminder, visit club65plus.com, schedule your Medicare review with us, and share today's program with a friend. Remember, we're at club65plus.com. I want to thank you for sharing your time with me this morning on Club 65 Plus Medicare Mondays with Renee.